pale skin, tiredness, breathlessness, repeated infections over a short space of time, unusual and frequent bleeding such as bleeding gums or nosebleeds, high temperature, excessive sweating, bone and joint pain, easily bruised skin, weight loss, headaches, seizures, vomiting, blurred vision, dizziness, swollen lymph nodes, pale skin, tiredness, breathlessness, repeated infections over a short space of time, unusual and frequent bleeding such as bleeding gums or nosebleeds, high temperature, excessive sweating, bone and joint pain, easily bruised skin, weight loss, headaches, seizures, vomiting, blurred vision, dizziness, swollen lymph nodes. Leukemia is cancer of the white blood cells. The word acute in this context indicates that the condition progresses rapidly and aggressively and requires immediate treatment. Blood cells are produced by bone marrow. Bone marrow is a spongy material found inside bones. It is important because it produces special cells called stem cells. Stem cells are very useful because they create other specialized cells such as red blood cells, which carry oxygen around the body, white blood cells, which help fight infection, and platelets, which help stop bleeding. Unfortunately, in cases of acute leukemia, the affected bone marrow begins to release a large number of immature white blood cells at the expense of normal bone marrow cells. This means that the body does not have enough red blood cells or platelet cells. This can cause symptoms of anemia, such as tiredness, and increase the risk of excessive bleeding. Furthermore, as the white blood cells are not properly formed, they become less effective at fighting bacteria and viruses. This increases the risk of infections. In some cases, affected cells may spread from the bloodstream into the central nervous system. This can cause symptoms relating to the brain and the spinal cord. Two main types of white blood cells can give rise to cancer: lymphocytes. These are mostly used to fight viral infections. Myeloid cells. These perform a number of different functions, such as fighting bacterial infections, defending the body against parasites, and preventing the spread of tissue damage. Acute myeloid leukemia is an aggressive, rapidly progressing cancer of myeloid cells. Symptoms usually begin slowly before rapidly getting severe and include pale skin, tiredness, breathlessness, repeated infections over a short space of time, unusual and frequent bleeding such as bleeding gums or nosebleeds, high temperature, excessive sweating, bone and joint pain, easily bruised skin, weight loss, headaches, seizures, vomiting, blurred vision, dizziness, swollen lymph nodes. If you suspect acute myeloid leukemia in you or your child, see your doctor as soon as possible. You may just save a life. Chromosomes 9 and 22.